Hi, my name is Matthew Lacey. I'm a certified lymphedema therapist. Today's video is going to be discussing self-manual lymphatic drainage. So this is MLD for short. I'm going to refer to it as MLD throughout this video. This is to be performed at home, this version I'm teaching, and this is what I would consider a simplified version of traditional MLD. Before you perform any MLD at home, you should discuss it with your certified lymphedema therapist or your physician to determine whether it's appropriate and safe for your situation. The other thing I would say is that abdominal massage can be upsetting to some people if they have certain kind of medical conditions, so that's another reason you need to discuss these things with your physician before attempting it. But to jump right in, this is going to be manual lymphatic drainage for the lower extremity. I'm going to be working on my right leg for demonstration purposes. The same exact drainage sequence can be mirrored on the left-hand side. So if you are a bilateral lower extremity client, you can do this on one side and then the other. Both extremities start in the abdomen. And with the belly massage, we're going to be dividing it into lower abdominal and upper abdominal massage. With the lower abdominal, what you're going to do is take a big deep breath in through your nose, get your belly to rise, and when you exhale, press and push on your lower stomach. Do this in a reclined position and ideally with a slight bend in your knees. It helps to relax the abdominal muscles. I'm going to do it edge of bed for purposes so that you can see what I'm doing with my hands. I'll do a few on the lower belly in this position and then I'll switch to the table for the remainder. So start on the lower part of your stomach, just below your belly button. We're going to do 5 big deep breaths with pressure on the exhale. So 1, 2, 3, 4, 5 deep breaths on the lower abdomen with pressure. The upper belly I'm going to do in the proper position, reclined with a knee bend. So sit in your bed or recliner at home, slight bend in your knees. Upper abdomen, we're going to feel for the rib cage. Come just below so that you're only hitting soft tissue. It's going to be around your belly button. It might be slightly higher than your belly button. A little bit of bend in your knees, big deep breath. And downward pressure. If you're pushing hard enough that you can feel a pulse in your abdomen, you're pushing way too hard. You need to back off. Also, if you're having any sudden pains or unexpected abdominal pain, it's a good idea that you discontinue this part and discuss it with a healthcare provider. So another big deep breath. We're going to do 5. So after we finish the abdominal component of the manual lymphatic drainage, we're going to move to the leg that we are working with. Right now I'm going to be working on my right leg. This can be mirrored to the left side, just remember that. The first thing we do is in the groin crease. So we're going to work in circles, stationary circles. So we're going to, rather than gliding the hand over the skin of the groin crease, we're going to pretend like our fingers are pasted and stretch the skin in a half circle toward our body. This looks, for purposes, I would not do this standing, but so you can see, rotate in toward the abdomen. My hand placement is where my hip hinges in the front, with the fingertips on the leg. Do this about 10 times. More is okay. 10 is a good number of repetitions. And sit in a reclined position. Once we have finished the groin crease, we've stimulated the inguinal lymph nodes. Now we're going to start stimulating the lymphatics of the leg. So to start, we're going to work the segment from our knee to the hip. Start with your hands on your thigh. If you can, reach full circumference of your thigh so that you're getting surface contact over the entirety of the front and back of your leg. That's fine. If you need to, just work on the front and then the back. That is how a lot of people are going to be needing to do this. I'm going to do it that way with demonstration. So with the top part of your leg, the front side, lay your hands on top of your thigh, stretching your skin and relaxing it. Move up a hand's width, stretch the skin and relax it. Stretch the skin and relax. To give a more straight view, stretch the skin, relax, stretch the skin, and stretch. Working from knee to the bend of your leg in segments. Always let the skin fully recoil. So we do our stretch, let it relax completely, move up. Stretch, relax, stretch, relax. Repeat this around 5 times, moving from point A to B. The next part is going to be the back of the thigh. Take your hands behind your knee, pull up toward the top of the thigh. Stretching and moving up in segments. Repeat 5 times or more if this is an area of concern and edema that's giving you trouble. The next thing we're going to do is behind the knee. If you can see the bend of my knee, the soft spot in the bend between the 2 tendons that run on either side of the knee bend, we're going to take our hands and massage up into the bend and relax off. Up into the bend and relax off. It's like a Ferris wheel. It's how I describe it to my clients. Fingertips in the bend, massage up and relax off. Repeat 10 times. And this is what my fingertips are doing behind my knee. Some pressure toward the kneecap and then relax it off. Repeat 10 times. The bottom segment of the leg from ankle to knee is performed in the same way as we did the thigh. You can reach down with your hand, stretch the skin from your ankle in hand's widths, working toward the knee. If your calf is large enough that you need to use both hands, that's fine. Stretch and relax, resting both of your hands on either side of your leg. Repeat this 5 times. When you've done the front of the leg 5 times, come from behind the calf to the front area of the shin. I like to alternate my hands. If we go from back to front with both hands, there's not much room to move in most cases. So alternate your hands coming around to the front side. Another thing you can do is just simply pulling up the back of your calf, stretching the skin. A combination of these is fine. You can do whatever's easier for you and feels like it gives you the best result as far as relieving some of the heaviness and tightness in the skin. Once you've repeated that 5 times, we're going to come back to the front. And we're doing everything we just did in reverse order, traveling back up the leg. So 5 times up the front of the shin. We're going to go back into the bend of the knee, massaging the lymph nodes in the bend 10 times. Or more. And any of these can be performed more in more repetitions. If your concerning area is here, spend more time there. If it's here, spend more time there. After the bend of the knee, we're going to come back from the back of the thigh to the top of the thigh. And it's best to not use lotion or anything that's slippery, because the idea with the manual lymph drainage is the stretching of the skin. After the back, we're going to do the top of the thigh again, or the front, stretching the skin toward the bend of the hip. Five times or more. After you've done that, we're going to come back into the bend of the leg, the groin crease, so that you can see, rotating in toward the abdomen. Repeat this 10 times. After completion of this, we're going to come back to the abdomen. If proximal swelling, so swelling in the abdomen, pelvis, or upper legs is a major concern, it's a good idea to hit the abdomen again, doing your deep breaths with pressure on the exhale on the lower and upper abdomen. This has been manual lymph drainage for the lower extremity only. The upper extremity is yet to come in another video, so stay tuned for that. But we hope that you have found this helpful, and we'll see you next time. Thank you.